Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. My name is Linda Hughes. I'm Chair of Alberta Health Services Board, and I'd like to welcome everyone to our first public board meeting of the fall. I hope you all had an opportunity to take some time off over the summer and rest and recharge. I'd like to share with you some of the work that AHS has been doing throughout the summer. As you may know, Alberta is consolidating lab services into a wholly owned subsidiary of AHS called Alberta Public Laboratories. APL will raise the bar for innovation, access, and quality in laboratory services in Alberta. This week, Craig Ivany started his role as CEO of APL. Craig's healthcare career spans more than 30 years, including a previous career in Alberta. Most recently, he served for 5 years as CEO of Eastern Ontario Regional Laboratory Association. There, he was involved in systems integration at the local, regional, and national level, experience that will help him very much in his new role. I'd like to take this opportunity to thank Mauro Kias, Vice President of Clinical Support Services, for taking on the role as interim CEO to get us where we are today. We'll keep Albertans updated on our progress as we move toward completion date in 2022. APL will transform how lab services are provided in the province, just as Connect Care will transform how we link patients, healthcare teams, and information. With Connect Care, health information will move with the patient from site to site and from service to service. And by logging on to Connect Care AHS patient portals, Albertans will be able to see their lab results, review their care plan, review their healthcare visit history, receive alerts about upcoming appointments, and message their healthcare team if they have questions about their treatment. This is a big project and an important one, and we need to get it right. So far, we've brought together thousands of staff, physicians, and patient advisors from across the province to help us design Connect Care. Over the summer, we held several adoption and validation sessions. During these sessions, AHS staff and physicians reviewed the design to ensure Connect Care best supports their day-to-day work when it launches. These two projects are important for Alberta Health Services to reach its full potential as a province-wide, fully integrated health system. AHS received other exciting news over the summer. The Canadian College of Health Leaders published an article highlighting AHS's achievements as the organization approaches its 10th anniversary next April. The article, titled "One Province, One Healthcare System, A Decade of Healthcare Transformation in Alberta," provides examples of how AHS is strengthening partnerships, standardizing best practices, and driving innovation. It also shows how AHS is capitalizing on province-wide integration to build workplace culture, enhance patient and workplace safety, and improve financial sustainability. A link to the article is on the homepage of AHS's website, and I encourage you to give it a read. A few weeks ago, following publication of the article, AHS President and CEO Dr. Verna Yu hosted a national webinar to discuss the article's findings in more details and answer questions from webinar participants. We were told it was the most popular webinar ever hosted by the Canadian College of Health Leaders. Health professionals from across the country joined in to hear Dr. Yu talk about how Alberta is transforming the healthcare system. It's heartening to see that others are recognizing AHS as a high-performing healthcare system. I'll pass the mic over to our President and CEO in a minute, who has some comments about the article, as well as about AHS activities over the summer and through the fall. But before I do that, can I ask, has everyone seen the agenda? And if so, could I ask someone to approval of the agenda? David? Glenda? All in favor? Thank you. That's passed. Declaration of conflict of interest. Does anyone have a conflict of interest they'd like to declare at this time? Okay, hearing none, move along. And you've all seen the minutes from our last meeting. Has anyone any issues or questions about the minutes? Could I ask someone to move approval? Rob, seconded by Marlis. All in favor? Thank you, that's passed. Now I'd like to hand the mic over to Verna.
Great. Thanks very much, Linda, and good afternoon to everyone. I want to pick up where Linda left off regarding the article published by the Canadian College of Health Leaders. I was particularly pleased by how the article looked at AHS as a whole and highlighted our achievements throughout the organization, as well as our ongoing efforts related to integration, innovation, quality safety, partnerships, treating people well, and maximizing the value of every health dollar. We've all worked on this concurrently over the past decade, and I'm glad the article captures all the work. Of course, credit for all these achievements really goes to the staff, physicians, and our volunteers, because without their talent, dedication, and commitment to patients and to each other, we would have not evolved into this high-performing healthcare organization where others are trying to emulate. Our people really are our greatest resource, and we see examples of that every day. So let me share with you a couple of examples now. For many children, the summer months are a time for going camping, getting outdoors, being active, being creative, and making friendships that can last a lifetime. But sadly, Alberta Health Services cares for many children and youth who can't attend a typical summer camp because of their illness. So I wanted to highlight the efforts of AHS staff and physicians who have taken it upon themselves to create specialized summer camps for many of our young patients. In July, the Glenrose Rehab Hospital held a 2-week brain camp for children with cerebral palsy who continue to struggle with effects of having had a stroke while in the womb or shortly after birth. These strokes have impaired their motor function, so this brain camp combines innovative rehab led by AHS staff with a wide range of fun yet therapeutic activities, from making crafts to preparing food in the kitchen. And the peer support is huge. This is an opportunity for these brain campers to meet and have fun with other kids with similar challenges, and you can't overstate the importance of that feeling of belonging, of feeling that you're not alone. I'd like to show you a video of another camp, this one organized by staff and physicians at the Stollery Children's Hospital for young people with heart disease. Please take a look.
Heart Heroes Camp is a medically supervised camp for kids who are born or have serious forms of acquired heart disease. Our camp here is a weekend-long sleepover summer camp program for kids who are aged 8 to 14. I think there's a couple of things that are a little bit different about our camp compared to some of the other camps. Every camp counselor that we have here is either a nurse or a doctor. We all work at the Stollery Children's Hospital. So we have a pediatric cardiologist here for the weekend, as well as a general pediatrician and 2 doctors from our cardiac ICU. These are some amazing kids, but they just don't have the same opportunities that other kids have because of their medical condition. And I felt like we were uniquely positioned to be able to provide them that experience.
It's really cool to see that the way all of the kids here come together, they share a really unique connection with each other. They all have medications to get. They all have special dietary restrictions. They all require the same amount of care, so they don't feel different here. That's so important for kids to have, is the sense of belonging and feeling normal.
When I was born, I had a hole in my heart, but my parents didn't realize that till I was 4, and so I had surgery on that. Sometimes we don't get the experience because we're sick sometimes. People like me are here, and I don't feel like different. I feel normal.
It's fun, I have to say that. It's safe, it makes me feel safe. High ropes is usually one of the fun parts. There's also archery that we're going to be doing, I like that. And hanging out with people I know.
I think the feedback's just been phenomenal. You know, the parents really appreciate the program, and the kids, I think, have left with some incredible memories, with some lifelong friendships, and with more of a sense of belonging, having seen other kids who have gone through similar experiences, and just being able to come and share a weekend with them and just have fun. Like, I think that's an invaluable experience for these families.
So I think you would agree with me that those are really amazing kids, as well as amazing healthcare providers. Camps like these to really demonstrate what patient-centered care is all about. That is not just treating illness, but caring for the whole person. That's what Alberta Health Services is all about. Now that we look ahead, and for AHS, our fall calendar includes several important engagement events for our organization. Last week in Edmonton, our foundation relation team brought together AHS leadership and more than 100 representatives from 40 health foundations and trusts for the 8th Annual Foundations Leadership Forum. The 3-day event offered networking and educational opportunities and included keynote speakers and workshop sessions. This is a yearly chance for AHS and foundation leadership to meet face-to-face and talk about our respective goals and how we can work together to ensure that donor dollars are invested where they will make the best difference and biggest difference in people's lives. And given that foundations raise $250 million every year, these are obviously important conversations to have. I've received some very positive initial feedback from some of the participants and look forward to hearing about what was discussed over the 3 days. Next month, AHS will be hosting the 2018 Quality and Safety Summit at the University of Calgary. Nearly 500 people, including 80 patient advisors, will attend over the course of 2 days. They'll talk about healthcare transformation and seek new ways to address persisting challenges faced by AHS and really health systems across Canada. Also next month, AHS is presenting the 2018 Advisory Council Fall Forum, which brings together AHS leadership with representatives from many of our advisory councils. This year's event is titled, What Matters to You? A Wellness Conversation, and is expected to draw about 180 participants. This year's theme builds upon What Matters to You Day and focuses on wellness versus illness. Community engagement will work with council members to identify ways to support a change in our conversations from illness to wellness. This is also a great opportunity to network, to share information, and to help new advisory council members understand the role of AHS and the important work of the councils. Our many advisory councils make AHS a better health system and one that's more attuned and responsive to the needs of Albertans and the communities that we serve. In fact, the Canadian College of Health Leaders article highlights the contributions of advisory councils and health foundations in Alberta's healthcare system. And it's clear that the achievements of AHS would not be possible without these and other important partnerships. With that, I'd like to thank all of you here and those watching on Facebook Live for your continued interest in AHS and Alberta's healthcare system.
Thank you, Verna. Now if we could move on to the Quality and Safety Committee with a report from Glenda.
Thank you. The Quality and Safety Committee met on September 12th, 2018. The agenda items focused on the 3 areas of access, quality, and safety. The committee had discussions on the AHS access improvement initiatives, as well as an update on a multi-casualty simulation that was recently held at Foothills Emergency Department. The committee heard a presentation on how Connect Care will support appropriate care in some very leading-edge work that's occurring there. There was also an update on quality initiatives in the organization. The committee was reminded, and Verna just mentioned this, of the Quality Summit that's going to be held in Calgary on October 17th and 18th. The committee reviewed the Infection Prevention and Control Annual Report, which provides an overview of the outcomes achieved in partnership with programs across the province, including accountability and monitoring, province-wide surveillance, human resource capacity, physical environment and infrastructure, and public awareness and education. The committee recommended that the board approve the report for submission to Alberta Health. Accordingly, I move that the Alberta Health Services Board approve the 2017-18 Infection Prevention and Control Annual Report for submission to Alberta Health.
Thank you. Could I have a seconder? Brenda. All in favor? That's carried. Thank you. Now we could move on to the Finance Committee. David?
Thank you, Madam Chair. Finance Committee met on August 8th and again on September 13th, 2018. We considered 3 items for recommendation for the approval of the board. First, the 2018-19 first quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. Regional Health Authorities regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented with June 30th, 2018 first quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and is certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. A, as at June 30th, 2018, AHS held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $1.523 billion. B, funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended June 30th, 2018 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from AHS and Phillips Hager North Investment Management. I so move.
Thank you. Could I have a second? Rob? All in favor? That's carried. Thank you.
Second, the committee considered a master services agreement between AHS and Walden Heights Seniors Community Incorporated and an amending agreement with respect to existing service schedules. These agreements required AHS board approval on delegation of signing authority in accordance with Policy 1100, the delegation of authority and establishment of controls for commitments. Accordingly, I move that the Alberta Health Services Board A, approve the amended and restated master services agreement with Walden Heights Seniors Community Incorporated. B, approve an amending agreement to amend the existing service schedules for Walden Heights Seniors Community Incorporated. And C, delegate the signing authority of the amended and restated master services agreement and amending agreements to the President and Chief Executive Officer. I so move.
Thank you, David. Could I have a seconder? Glenda? All in favor?
Third, Alberta Health Services is the sole shareholder of Alberta Public Laboratories Ltd., formerly Calgary Laboratory Services Ltd. At its August 30th, 2018 meeting, the board supported the delegating authority over the business and affairs of APL, Alberta Public Laboratories Ltd., to the AHS CEO. Accordingly, I move that Alberta Health Services Board approve the delegation to President and Chief Executive Officer of the general supervision over the business and affairs of Alberta Public Laboratories Ltd., including the authority to approve and sign on behalf of AHS as sole shareholder of Alberta Public Laboratories Ltd., resolutions and agreements as may be necessary or desirable from time to time, and the power to subdelegate the authority granted. I so move.
Thank you. A seconder? Marlis? All in favor? That's carried. Back to you, David, again on audit and risk.
So the Audit and Risk Committee met on September 13th, 2018. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS. The committee was presented with a quarterly report on the activities of the AHS internal audit and enterprise risk management team and an update on the enterprise risk management framework. There was one item presented at the committee to be considered for board approval. The committee received an updated internal audit charter to recommend for board approval. The board has reviewed the updates and supports the approval. Accordingly, I move that the Alberta Health Services Board approve the updated internal audit charter as reviewed by the board. I so move.
Thank you, David. Seconder? Rob? All in favor? It's carried. Thank you, David. Now, Community Engagement Committee, Brenda.
Thank you, Linda. The Community Engagement Committee met on September 19th, 2018. Representatives from the Calgary Health Trust attended the meeting, and the committee also viewed a film chronicling the health care journey of Greg Price and had a discussion with Greg's father, David Price. The committee considered two recommendations for approval of the board. First, with respect to the first item, the responsibility to appoint trustees to established foundations lies with the AHS Board. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the Community Engagement Committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? David, all in favor? Thank you, that's carried.
With respect to the second item, under the amended bylaw for Alberta Health Services establishing health advisory councils, the AHS Board is required to approve renewals and appointments of members to the health advisory councils. In addition, the Board is required to approve membership appointments for each of the provincial advisory councils. The committee reviewed appointments to certain advisory councils effective October 1st, 2018, and recommended that the AHS Board approve such appointments. Again, we are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Again, given the number of appointments, the names will not be read at this meeting, but they will be posted and made available in the minutes of the meeting. Accordingly, I move that the Alberta Health Services Board approve the new member appointments to the Health Advisory Councils and the appointment renewals to the Cancer Provincial Advisory Council effective October 1, 2018, as reviewed by the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Glenda, all in favor? That's carried. Thank you. And finally, Human Resources Committee and our chair, Marlis Taylor.
Thank you, Madam Chair. The Human Resources Committee met on September 27th, 2018. The committee received a standing quarterly report on our people results and a labor relations update. The committee also received an update on the status of midwifery negotiations and the PeopleSoft system upgrade. Finally, the committee received a presentation on the successful safety initiatives employed in the North Zone. There were no items that came through the committee for board approval.
Thank you, Marlis. Short and sweet. All right, I now declare the meeting adjourned. Thank you all very much.
Together, we do amazing things every day.